Welcome to The Explainer. Today we're unpacking one of the most fascinating and frankly highly debated case studies in modern corporate history. I'm talking about the AbbVie Humira story. Now, we aren't just looking at a pharmaceutical product here. We're looking at an absolute masterclass in business strategy, intellectual property, and what it really takes to build an impenetrable corporate fortress. So if you want to understand how modern business moats are actually built, you're in exactly the right place. All right, let's jump right in. Imagine a massive corporate dilemma. You've got a multi-billion-dollar product. It's wildly successful, right? But your legal monopoly, that core patent protecting it from competition, is about to expire. For most companies, this means facing the dreaded patent cliff, where competitors just flood the market and your revenues plummet overnight. So how on earth does a company prevent that? How do they keep those fortress gates closed? Well, the answer often lies in a strategy known as evergreening. Now, think about this through an architectural lens. Evergreening isn't about, magically extending the expiration date of that original foundational patent. That is legally impossible. Instead, it's the practice of obtaining dozens, sometimes hundreds, of secondary patents right around the time that primary patent is expiring. You're not extending the timeline of the original molecule, you're building a massive, highly complex protective wall around it to maintain that market exclusivity. Part 1, Building the Chronological Fortress, Constructing the Thicket in Plain Sight. Let's trace how this builds over a span of 2 decades, because it's wild. It all kicks off in December 2002. Humira gets FDA approval as a treatment for rheumatoid arthritis. And to be clear, it was a genuine medical breakthrough, literally the world's first fully human monoclonal antibody. The core patent protected this invention until December 2016. But look at this jump to 2023. The core patent expires in 2016, yet the U.S. market didn't open to competitors until January 2023. That is a massive 7-year gap. So how did they pull that off? That 7-year gap comes down to this crucial, almost unbelievable statistic. 90% of the patent applications for Humira were filed after the drug was already approved and brought to market in 2003. Let that sink in. AbbVie wasn't out there inventing a totally new drug during this time. No. They were quietly and systematically patenting every conceivable detail surrounding the existing one. So, what exactly were they patenting? Well, they applied for over 300 patents and were granted 165 of them in the US alone. We're talking new formulations like citrate-free and high-concentration versions. They patented specific manufacturing processes, physical delivery devices, exact dosing regimens, and even the pH buffers used in the liquid. They also secured secondary patents for orphan and pediatric designations, which, carry their own extended protection periods. They wove a web so tight that some of these secondary patents extended all the way out to 2034. Which brings us to part 2, the settlement web, or the patent cliff that never came. So December 2016 finally arrives. That main composition of matter patent expires. In a normal product life cycle, this is exactly when competing generic versions known as biosimilars enter the market. Over in Europe, the gates opened, and that's exactly what happened in 2018. But in the United States, absolutely nothing happened. The market remained completely locked behind that thicket of over 100 secondary patents. Now, competitors definitely tried to break in. Amgen even won FDA approval for a biosimilar. But AbbVie immediately sued every single challenger. And here's where the sheer brilliance of the settlement web comes into play. AbbVie went to these competitors and basically offered a choice. They said, you can spend years and tens of millions of dollars fighting over 70 different patents in court, or you can just acknowledge our patents are valid and we'll grant you a guaranteed licensed entry date in 2023. Faced with that kind of legal mountain, competitors did the only rational thing. They settled, every single one of them. Now, part 3, financial and human costs, the true price of the fortress. $114 billion. I really want that number to land for a second. That is the amount of extra revenue Humira earned in the United States during those 7 extra years of exclusivity between 2016 and 2023. To put that staggering figure into perspective, AbbVie earned more in those extra 7 years of the patent thicket than it did in the drug's first 13 years on the market combined. That equates to roughly $40 million in revenue every single day. But there's obviously a very real patient cost to maintaining a monopoly like this. Since its launch, the price of Humira increased by 470%. By the time the fortress finally opened in 2023, a year's supply in the U.S. cost approximately $77,000. That breaks down to about $4,500 a month for patients relying on these really vital injections. And many of those price hikes occurred precisely during that 7-year extended window. Naturally, an aggressive strategy like this sparked massive backlash. It drew severe criticism from U.S. senators and patient advocacy groups alike. However, it's absolutely crucial to look at the objective legal reality here. When challenged, federal judges ultimately ruled that AbbVie's web of 132 active patents did not violate antitrust laws. The courts determined that the company was simply exploiting the legal advantages already built into the U.S. patent system. So, highly controversial? Yes, without a doubt, but legally sound under current precedent. And that brings us to part 4, the business innovation system, a masterclass in moat maximization. Understanding this strategy isn't just about healthcare, it's about deeply understanding how modern corporate monopolies are fundamentally engineered. If we zoom out and view this whole thing through the lens of business administration, it becomes clear this wasn't just a bunch of random legal filings. It was a flawlessly executed system of lifecycle management based on 3 underlying steps: transforming a product into a platform, utilizing litigation as a business model, and executing revenue recycling. Let's break these down, because this is where the true innovation lies. First up, Principle 1, product to platform. AbbVie essentially stopped looking at Humira as just a single drug and started treating it as an entire ecosystem. In business theory, this leans heavily on the resource-based view of the firm. They looked at their internal, everyday operations, things like the exact temperature a liquid is mixed at, or the specific buffer used to keep it stable. Historically, those were just internal trade secrets, but AbbVie innovated by taking those tiny operational details and turning them into formally codified, legally defensible intellectual property assets. They literally patented the process of making the drug. Then we have Principle 2, which is all about leveraging game theory. The overarching goal of accumulating 165 granted patents was never to actually fight and win 165 separate lawsuits. That would be totally chaotic. The actual goal was to raise the cost of entry so high that litigation became economically unviable for anyone else. The brilliant innovation here wasn't legal victory, it was economic deterrence. When a biosimilar company sat down and did the math, 7 years of expensive, incredibly risky court battles versus a guaranteed risk-free entry in 2023, settling just became the only mathematically rational choice. And finally, Principle 3, revenue recycling. That extra $114 billion wasn't just distributed as pure profit to sit in a bank account somewhere. It was systematically reinvested to fund AbbVie's next generation of immunology drugs, specifically Skyrizi and Rinvoq. And today, those new drugs generate even more revenue than Humira ever did. So the ultimate business innovation of the Fortress strategy isn't just protecting the past, it's actively financing the future. Ultimately, how you view this depends entirely on where you sit. Critics look at this and see evergreening, a manipulative tactic that artificially inflates healthcare costs and exploits systemic loopholes. Investors and business administrators, however, look at the exact same data and see brilliant lifecycle management, a highly effective, legally validated system for maximizing the value of a core asset. Which leaves us with this final thought to ponder. We so often think of a patent as just a simple legal document, something that protects a single bright idea. But as the Humira case study shows us, when you strategically layer 165 of them together, they transform into something entirely different. So, is a patent just a document? Or is a thicket of 165 of them the ultimate strategic negotiation monopoly? Thank you so much for joining me on this explainer. I really hope this helps you see corporate strategy in a whole new light. Keep questioning the systems around you.